How does stimulability assessment help diagnose speech-sound articulation issues? Imagine trying to learn a new skill and having someone show you how to do it. That's similar to what stimulability assessment does for children with speech issues. It's a way for speech-language pathologists to see how well a child can produce sounds when given a little help. This test isn't just about what the child can do on their own, but also about what they can do with some cues or prompts. It helps figure out if the child can learn to say a sound correctly with practice. During the assessment, the child is asked to repeat sounds in isolation, like just the letter or sound, or in simple syllables. The speech therapist might use different vowel sounds like as in C, as in cat, or as in blue. They also check sounds at the beginning, middle, and end of words. The therapist provides models or cues and watches if the child can imitate the sounds. If the child can produce the sound with help, it shows they have the potential to learn it. This process helps identify which sounds the child can learn to produce more easily. If a child can say a sound when prompted, that sound might be easier to work on first in therapy. It also helps tell the difference between a child who has a more severe speech problem and one with milder or emerging issues. If a child can produce sounds with help, it suggests their motor and sensory systems are working well enough to support learning new sounds. Stimulability assessment also guides treatment planning. For sounds the child is already stimulable for, therapy can focus on improving those sounds further. For sounds that are not stimulable, the therapist might need to use different methods, like biofeedback or other techniques. This assessment can also predict how well a child might do in therapy. Children who are stimulable for certain sounds tend to make faster progress with traditional speech therapy. In addition, stimulability shows what the child can do in different contexts. Sometimes a child might not say a sound correctly in conversation but can produce it when given cues. This helps the therapist understand the child's full speech abilities. Usually, this assessment is part of a broader evaluation that looks at the child's overall speech sounds. It helps determine which sounds to target first and how to approach therapy. Overall, stimulability assessment is a key tool because it reveals the child's capacity to produce sounds beyond just their errors. It helps speech therapists plan effective, personalized treatment. It shows which sounds the child is ready to learn and how best to support their progress. This makes therapy more focused and increases the chances of success in helping children speak clearly and confidently.